Okay, so I'm going to dive straight into my introduction here. So, you ready, Aadila?
Mm-hmm.
Okay. Okay, here we go. Hi, I'm Tyson Franklin, and welcome to this week's episode of the Podiatry Legends podcast. The podcast designed to help you feel, see, and think differently about the podiatry profession. With me is a good friend, Aadila Dada. She has Prohealth Podiatry in Brisbane, and we're going to talk about nutrition. I think diabetes education, because Aadila has a very special interest in this particular area. And it's an area I know a lot of podiatrists have an interest in as well, because every conference you go to, there's a substantial chunk of the education is in this area. So I thought it'd be a great thing to talk about, and also have somebody on whom I'm friend with and is quite passionate in this area. So Aadila, how are you doing?
Good. How are you?
I am great. Now, don't be nervous.
No, I'm fine.
Don't be nervous. Be nice and calm. This is a friendly podcast. Anyone that's listened, and you've listened to most of the episodes, so you know.
Yes, no. I know how it ends.
Yeah. You know, I'm not like Willisy or anything, asking really, really tough questions.
No, you're fine.
Yeah, like political journalists. So one thing I wanted to ask you up front pretty early on, and like to ask everybody this when I remember, is what got you into podiatry?
I've always known I want to go into podiatry.
Right from the beginning?
Right from the beginning. So I played tennis when I was young. So first it was a tennis player. Then it was med. So it was always podiatry was going to be my stepping stone to med. But it was always podiatry. So I got injured when I was young. I come from South Africa. So I
was going to comment and just say, just in case anyone's thinking, hang on, wrong. Yeah, is there an accent there? I can't pick it up yet. So you are from South Africa.
Yeah. And
was your goal to be a professional tennis player? Is that what you wanted to do when you were younger?
Originally, but I was awful at it.
That's not me in surfing. I was telling you before. It was easy to give up because I was no good at it.
No good at it. Yeah, exactly. So then I had a steel door slammed on my toe, and I had to visit the podiatrist, right?
Yeah.
And back then, a burr looked so damn impressive. Like to a 7-year-old, a burr was like, wow. That's all he did. He just burred the toe and leveled it off, and off it grew. And that was amazing. So podiatry it was.
That is really cool that you actually mentioned that. Because, you know, when we've spoken previously, like in the Spartans group, we'll talk about shooting videos and what type of videos should you be shooting and what's going to be interesting to patients. But even you just saying that about as a 7-year-old seeing a burr for the first time, that it's something that we don't even think about.
No, that's right.
Yeah. And think of all the different types of burrs we have and the different things we do with them.
And I was sold just on a burr.
Yeah. So you sold on podiatry as a 7-year-old because of a burr.
Exactly. A burr.
So did that just stick with you that whole time, or was there a period of time you just totally forgot about it and then it came back? Did something spark it off?
No, I was actually in year 10 in South Africa when my dad, I lost my grandfather through a shooting.
Oh, okay.
So my dad basically made the decision to move to Australia. At that time, we had family stationed here. So when he came over, he said, what do you want to do? Are you moving? And you're going to have to repeat year 11, because it was the OP system, right?
Yeah.
And I said, hell no, you ain't going to take me out of South Africa if I've got to redo the OP system. At that time.
How old were you then? Was that grade 10?
I was in year 10, so probably 15.
Yeah. So what year was that?
Year 10. It would have been year 10.
What year? 19?
I can't even remember.
Can't remember.
So I would move here in 2001. So I would say, but 1998, 1999.
Okay. No, I just had I've had other friends that moved from South Africa as well, and they moved for the same reason. Just they had friends that had been injured or shot or killed, and they just went, it was time to leave.
I can't even remember. I really can't even remember. At that time, I was doing well in school.
Yeah.
Right. And was part of the netball team. I was loving my life. So moving to Australia was the last thing on my agenda.
So even though your grandfather got killed, you didn't feel in danger yourself, or that South Africa at the time may have been dangerous?
No, I had a close-knitted family. So to me, moving here meant isolation.
Okay.
So I really didn't want to leave everything I knew. And my dad was quite adamant. That's it. We're gone.
But did he give you a choice?
No, he basically said, how are you going to move there? And I said, oh, well, I'm getting into podiatry. So if you get me into podiatry, I'll move. I'm not redoing year 11. I'm not redoing it. And he said, well, what are you going to do? You're not going to make the OP results. And I said, well, that's your problem, isn't it? So being like the idiot I was, he came over here. And at that time, it was Alan Crawford in the school. And I have no idea who he met with. So he sent me this list and he says, okay, if you can pull this off, you're going to get into university, but only if you pull this off.
Yeah.
And that was what happened. I worked my little behind off for a little while. And then podiatry it was. I hesitated at the last minute. I have to be honest. At the last second, I thought, what the hell? Should I go into podiatry? I just thought, am I so narrow-minded that I've not thought about anything else? Like I've not even considered anything else. So everyone around me was doing physiotherapy or optometry. Like they were doing cool things. To me, podiatry's feet.
And a burr. And you thought, all you're doing is burring nails all day.
So yeah, so at that last second, when the QTAC thing came in and I filled out podiatry. And then for heck's sake, I said at the end, okay, physiotherapy. But I was already 90% into podiatry. I just had to fulfill my.
Had you spoken to Alan Crawford beforehand, or you just knew he was head of the department?
Nothing. I just knew he was head of the department. So I knew nothing about anybody. I was just being a real teenager.
Yeah. I'll have to show you next time we're on a Zoom call with a group. I've got to get out some of the student magazines we did while we were there, and we always we put Alan Crawford in both years as a centerfold.
Very cool.
They're really, really funny. So I'll have to show them to you. And I should take pictures and put them on my website. So if people listening to this podcast can go to that episode and see these pictures from, and then it's not really him, but we've done enough to it to make it actually look
photoshopped
like
it.
Yeah. I think one is actually Patrick Swayze in centerfold doing this real dirty dancing move, and it's just the angle that he's on, and we put a mustache on him, and it looked like Crawford. So, and I think he thought it was great that we equated him and Patrick Swayze.
In the same, it was ego boosting.
So that was in, I think, 1988 and 87 and 88. We did the two magazines.
Oh, pretty cool.
So it was very, very funny. Anyway, back onto you. So once you started podiatry, no doubts. Once you got into it and you were studying, you knew you were in the right place.
No.
Okay.
No, honestly, absolutely not. I questioned it all the time. I ended up teenager. I ended up marrying my husband when I was 18.
Jeez.
Yeah, teenager. I knew better.
So was he already over here, or was he in South Africa and came over?
He was already here. So he's also South African, but they moved over way before I did. So they lived in Victoria for a while, and then they moved over to Queensland. So I needed to prove that I was going ahead without my parents. So so marrying it was at 18.
So was it arranged?
No.
No. Okay. I'm just checking.
No.
Just checking.
No, this is me, Tyson.
I know. Like, that's why we're surprised. But I just wondered, because I've had friends with different religions who they had arranged marriage and it was fantastic for them.
No.
So no, it was your own choice.
No, I don't take instructions very well. So
I can vouch for that.
So then I had my daughter in the second year, the first semester of the second year of podiatry.
Wow.
I had to break rules. And then I just found it extremely difficult because I ended up getting ill and not knowing why I was ill. So to everyone else at uni, I must have been a doozy because I forever made excuses as to why I was not there or where the hell was I. And then I fell pregnant with Hamza in my fourth year. And unfortunately, I missed a lot of student clinics. So I fulfilled all my obligations and my placements. But I was really ill towards the end of podiatry.
Okay, so you had two children while you did your podiatry degree.
Yes, I think my picture on the wall could actually have me as pregnant.
Oh, well, you pretty much would have been pregnant for almost 50% of the.
I would have looked like that hobo lady, that wild lady, that wild pregnant. I still only have 2 kids, just for the record.
You didn't decide to just go and have a pile more afterwards. You couldn't have waited a couple of years. You couldn't have just said, let's just wait a couple of years and get through uni first.
No, to me, I needed to defy everyone. I needed to do things my way. So I went and did it.
Okay. So you managed to get through podiatry. You decided to do it the hard way. I thought having a part-time job was difficult. But I used to kill chickens. So, but I think having children doing podiatry is much harder than killing chickens, because that was my job.
I don't know how you did that. I don't know how you did that.
Easy. It was terrible. It was an awful job. Yeah. It was an awful job that actually, what's funny, it paid more money working on a chook farm killing chickens than when I graduated and my first job I got offered was less money than killing chickens. So you know what I did?
Yeah.
I killed chickens. I decided not to take that job. I thought, I'm going to kill chickens because I'm getting paid more and I'll just work for myself. So I did the two together, because killing chickens, I could start at 5 a.m. in the morning.
That's
and
crazy.
Finish by about 5 or 10 and then start working my own clinics. I'm not saying that's what you should be doing, but
that's crazy.
Everyone's got weird stories.
We had a fruit shop in between uni.
Yeah.
So we had so if you know Brisbane, right?
Yes.
So you know Brassel and Esk on the way to Ipswich.
Yes.
So we had a fruit shop there when Sana was born. So I used a fruit shop. A fruit and veggie shop. Yeah.
Oh, right. So I thought you said a foot shop.
No, fruit shop.
If anybody else is listening to this, please
accent.
Please back me up that was a foot shop. And I'm thinking, okay, why not? You're doing podiatry, you may as well have a foot shop. So, but a fruit shop actually makes more sense now.
Hence why I used to miss lecture.
So this was your business as well?
This was my hobbies and mine. Yeah.
Okay. So just to stir things up a little bit more.
Yeah.
So how did you go in podiatry? Like, did you get good marks going through? Average, just above average?
I think I'm average. I wasn't like high flyer. No, I wasn't Miss Popular. I was forever pregnant.
You went at the top of the list for the invites for the parties.
Ended up getting, you're going to laugh at this. So 4th year, I don't know how it runs this time. You know how you have to make your orthotics?
Yeah.
As part of your grading, right?
Yeah.
So the orthotics went through the grinding machine, came out and sliced me between the eyes. So thank God I wear glasses. Yeah. Thank God. So and I'm going to the doctor. It's an Indian doctor at the Carver Grove Student Clinic. And he's like, so you Indian, aren't you worried about scars? And I'm like, no, just stitch me up. And I was sitting there. And he's like, okay, I'm going to stitch you so there's no scars. At that time when there's blood pouring, you couldn't get shit about whether there's a scar or not. Anyway, so that earned me an award at the graduation night.
And what was the award?
I can't even remember, but the prize was a pair of goggles.
It was, okay, so you got through. You managed to get through, a couple of kids, fruit shop, not a foot shop. Almost took an eye out, and you were saying that. So even though you weren't, like popular on the party scene because you were pregnant most of the time, you still would have made a lot of good friends going through podiatry, or you just didn't have time.
A little bit of both. So the friends I kept, I still have.
Yeah.
The people I did placement with, I still have. So I think it was lasting relationships. It's probably what shaped me in podiatry. So a few of the friends like I went through and I was stuck with the mature age group, right? Married and kids, just didn't look the part. Yeah. So I'm still really good friends with them. Some of them have moved overseas, unfortunately, but still good friends with all of them.
Yeah, I think everyone has a different experience. That's why I know like a lot of students listen to this podcast, and I think it's good for people to realize that not everyone has the same experience at uni.
No,
I be perfectly honest, I didn't enjoy uni at all.
Neither did I.
I went there. I hung around all the law students because they were part of the football team, and that's what I
But
play. And the podiatricians, even though I knew them all and did a little bit with them, I didn't do a lot with them because sometimes I was a little bit different.
See, I think that's what sets all of us apart, isn't it?
Mm. So anyway, so you got out of uni, you started work. Did you work for yourself straight away, or did you?
No, I did a lot of locums for Queensland Health.
Okay.
So in the chronic disease outpatient clinics, probably that's why diabetes. And then I did a lot of placements. So I used to, so the people I did my placement with initially after uni, they had a lot of work, right, in private health. So I started locuming for them. It gave me about 4 days worth of work with a small infant. So that was enough.
Yeah.
Then I took a little bit of a break. Oh, no, actually, I started working for Yvonne Chow Podiatry in Kirribilli, just close to home. I loved my experience there, but I ended up getting ill and working in my family business for a few years. So taking a bit of a break away from podiatry before I decided what I wanted to do with my life. And that was work for myself.
Okay. And you mentioned a few times about your illness. I
think it shaped me, doesn't it?
Yeah. So what can you share what the illness is, or?
Yes, I've got ulcerative colitis, or different. So ulcerative colitis. I was diagnosed at 22.
Okay. So were you doing podiatry then, or was it just afterwards?
I was still in podiatry then, because podiatry took me 5 years instead of 4, because I took 1 year over 2.
Okay.
Yeah, part-time.
Well, when I went through, I did 4 years instead of 3 because I enjoyed my company.
There you go.
I want you to stay for 12 months. I love having you around.
He loved you too much.
I don't want to see you leave. He said, can you stay for another year? He says, I just love having you around. The banter we have every day is just worth it. So you went through podiatry, 2 children, fruit shop, and at the same time, you discovered you had this illness, which I assume you would have had a lot of symptoms with it over a period of time before it hit you, or bang, it just happened all of a sudden?
No, I was pregnant with Hamza. And you know how in the 1 year you have the medicine component and the pharmacology component?
Yeah.
Right? It was late at night. I used to put the kids to bed and then go to study. And I was reading. So in the medicine component, I don't know how they do it these days, right? So we used to have, back in the days, before online blackboard. So we used to have like these paper written notes of the different illnesses and diagnoses and treatments, right?
Yeah.
And one of them was ulcerative colitis and one of them was Crohn's. And this would have been like probably 2 a.m. in the morning. And I end up shaking Mohammed, my husband, to say, I've got to go into the doctor. I've got colitis. And he's like, no, you don't. And I'm like, I've already spoken. I had a family friend who was an obstetrician.
Yeah.
So I'd already called him in the morning, already diagnosed myself, already had myself worked out that I needed to admit myself. And then I was telling Mohammed, I think I've got colitis. We need to go into hospital.
So, and this is before Google. So you didn't use Dr. Google.
This is before Google.
This is just
Google.
Your own notes.
My own podiatry notes.
Well, it's good though. It's good that you figured out what it was. Has that interfered with your work over the years? Like, if you had to have time off because it's flared up, giving you trouble, or is it just something you've managed?
No, I have had time in between of work because I had my bowel removed. So I have had time in between work that I've not been working. But it hasn't. I think it shaped the way I treat, if that makes sense.
Yeah.
Or shape the clinician I am.
Because so is it because you've had to what you ate yourself and how you manage your diet, which then made you think about your patients and how they have to manage theirs?
Yeah. So from a chronic disease and pain perspective and nutrition perspective, I think that's why I am invested or interested in the things I am. It comes from life skills, doesn't it? And the empathy.
I think so.
Yeah. Yes, because we all treat differently.
Well, I do believe somebody that is brought up, and not, I'm generalizing here, but somebody that has had everything handed to him the whole life, silver spoon in the mouth, best schools, went to university, parents paid for everything, didn't have to have a job, graduated. People have, say, just set clinics up from, they really haven't had any adversity in their life. I think could find it difficult to communicate with people that maybe have had some adversity. And I don't believe that anybody has sailed through life that easy. There has to be some ups and downs, which creates a person's personality.
I don't know. I think the harder you have to work for it, the more you want it.
Yeah.
It's kind of like our clinics, isn't it? The more effort you put into it early, you reap the rewards, whether it's in terms of financial or emotional, or because success is different to everybody, isn't it?
Oh, yeah, definitely. And it is. Yeah. And it's not, I always say it's not money. But remember, when James Kent was on episode, I can't remember the episode, and it was called Young, Poor and Single. And he's saying that's like one of the best motivators to have your own business is to be young, to be poor, and to be single. And I think it's, but then it all, like you said, all comes down to what do you define as success?
Yeah.
Some people live purely by money, others don't.
I don't know. I think it's knowing your own self. So it's your values, what you hold as important, and what you want and how you want that to translate into how you treat the clinic you want to have.
Yeah, I agree. So I'm going to ask you a question about your website. So on your website, you work for yourself now, Prohealth Podiatry. And on your website, it has here, helping hands for more than just your feet. I actually thought it was pretty clever. And what does that mean to you? If somebody read that on your website, what does it mean?
That's a shout out to one of your friends, Tyson Nikki.
Oh, right. Nikki okay.
Jerd.
Nikki Jerd.
Yeah, Nikki Jerd.
Nikki Jerd, a friendly neighborhood computer. And our, how do we refer to her? She's the
tech whiz.
What's that?
She's a tech whiz. She's a magician of everything's tech. Yeah.
She has been on the podcast and she will be back on again at some stage.
Yeah. What was the question?
So if somebody went to your website, or a patient or anybody, and it says helping hands for more than just your feet, what does that mean when you put that there? So I take it Nikki helped come up with the wording.
A little bit, but it was my website went under, long story, you know how my website went from one to another, and then we just had to reshape or reword everything.
And this one's better.
And this one's better than the old one. You know, when you have a patient that comes to your door, it's really that initial consult and looking and listening to the patient on a whole, right?
Yep.
So with me, I went through Southern Cross University for diabetes education. And at the moment, I'm going through the Australian College of Weight Management and Nutrition for a diploma in weight management and nutrition.
Yep. Because
after my stint in public health with the ulcers and wound management, it's actually, that's fun to me. I don't know if I'll go back to treating ulcers. Look, that's not everyone's cup of tea. So I don't know if I'll go back to treating ulcers.
You know, it's not mine. Even when someone says the word ulcer, I can start to smell it. Yes.
You would have loved my last week's patients.
But for some people, that is their, it sounds like bread and butter. It just sounds like it's spread out on there. But that's the thing, though. If somebody has to look after those type of patients and has got to have an interest in that area, so I'm glad it's you and not me.
So you know the thing is with most specialists, right? Even with myself included, you've got to look at the person as a whole. It's not just feet.
Yeah.
There's always something underlying it. So recently, there's been that whole movement towards gut health and sleep, and how your sleep affects your pain threshold, right? And also your gut health and what it means with your microbes and how it translates into chronic disease, right? So that's always fascinated me.
So so a lot of podiatrists will say, I have a special interest in diabetes. What made you decide to become a diabetes educator?
Obesity. look, when you speak to every doctor,
Yeah.
when you go into educate GPs, right? There's not, I think, I don't know what it's like for the rest of the world, but for Australia, a lot of people don't know what we do. No, I mean, when you talk podiatrists, it's all about cutting nails, and that's not what we do.
Yeah.
Right? In all honesty. So like when you went to talk to GPs, or when I went to self-promote myself, the diabetics and the people with osteoarthritis. Yeah, that is what we do. But we do so much more. Even with diabetes, you do so much more than just check the pulses and the nerves, and you look at the person as a whole, right?
Yeah.
And a lot of the time, what they eat also affects the person as a whole.
But is that what led on to you doing the diploma in nutrition? Is you did the diabetic education and then thought, I need to take this one step further. I need to learn more about nutrition so I can bring that back. And wouldn't be just your diabetic patients. Wouldn't it just be your other patients that you think could deal with a little bit of help?
It's the ego part of me. I like referring to a dietitian. I really do. I love my dietitian.
Yeah.
I'm going to one. I love my dietitian. I hate having to say, I don't know. So I needed to actually educate myself. And that was the next step.
Well, I don't think it's any different to someone referring a patient for surgery, but wanting to actually understand and study everything about the surgical procedure without actually having to do it.
And like all of us operate differently. So we spend half an hour with a patient. My consult is half an hour for a diabetes assessment.
Yep.
Right. So even with the dietitian, it's half an hour. Now, every dietitian is different. Don't get me wrong. I mean, like every podiatrist is different. Their method of educating is different. So a lot of the time I found that I was re-educating patients, and they were like, I didn't know that. But it's all from your diabetic online resources, right? So I'm not giving anything out of my legal range or what I'm not meant to. As podiatrists, we are meant to have a background information if you are educating your diabetic patients that come in.
Yeah.
And sometimes they were asking me things that I didn't know about. And I mean, and there's a lot of things that affect weight, right? Your hormones, how your body's functioning. I didn't know anything about all of those things. So I'm giving every person the same advice or the same education and saying, okay, thank you, see you later. And not actually changing it to look at that person as an individual or as or fine tuning my treatment for that individual patient.
So is the plan to still refer to a dietitian?
Yes. Yes.
But there's going to be certain patients that, well, I assume it's probably like a physiotherapist, for example, may use pre-made orthotics. Pre-made, over-the-counter orthotics, and they give that to certain patients. But there'll be certain patients that will still refer to a podiatrist.
There's lots of things you can use with nutrition, like how when you have a ward patients, we say, okay, do you take enough zinc? Do you eat enough zinc? Are you deficient in zinc? Or where a person comes in would say they've got neuropathy, and you're like, what's your B12 vitamin count like, or your blood? You do ask these things because it does. Do you know what I mean?
Yeah.
Yeah.
So by you improving your education in that area, you're providing a better service to your patients.
Yeah, I think so. Well, I hope so.
Well, also too, when you are talking to a dietitian. So how many people would you refer to a dietitian in an average, say, month?
Okay, so I work in a medical center, you know that.
Yeah.
So I work closely with a dietitian and a physiotherapist. So it is a good network to have, like to have an exercise physiologist, a physio, and a dietitian. So I refer on quite a lot, and so does she. She refers back the patients that she thinks has a problem or that she can't solve, or that do tell her that they have foot issues.
Yeah.
So it's actually important to
I do. I like the approach. So if somebody was listening to this and they were thinking, I want to become a diabetes educator, where do they start?
So there's a few not all the courses are accredited, or will be approved for a Medicare provider number.
Yeah.
So mine was initially the one closest to home, and the one which I work full time, so I really didn't want a lot of days out of clinic. So I took the one with the least contact hours and the one closest to me. So that was Southern Cross. I think it was 8 days on clinic, which is not bad considering that it's a year. So 8 days at Coolangatta. And then it was 4 units or 4 components online. And you had access to your lecturers or the help that you needed. So it was a year post-grad.
Okay, that's not too bad.
No, not at all.
If that just sounded like I was having a drink, then it was because I was having a drink then.
There is a catch. There's a catch.
Yeah.
There's a catch, right?
Catch.
So you're to be credentialed, you've got to do 1,000 hours face-to-face or online education. So even if you have your diabetic in and you're just doing a nail cutting, that does not count.
Okay, so it's got to be, you have to be talking about the education, the diabetes,
or improving.
And then you've got to log all this over 1,000.
You've got to log all of this.
It's a lot of hours.
You're telling me. It's a lot of hours. This Medicare provider number better be worth it.
What's the benefits once you get the Medicare provider number? What's the benefits of actually having that?
I think it's like the status code, isn't it? Like then you recognize by, I don't know why this is, then you recognize by other diabetes educators or you're called a credentialed diabetes educator for having the provider number or having been approved to practice under Medicare. But there's nothing really stopping you from doing it privately.
Okay, so if you didn't want to do it through Medicare, you could just
charge the patient.
Just charge the patient. Okay. So, and that's what, well, some people would do the course then and just go down that path and not worry about logging the 1,000 hours.
Medicine is strange, isn't it? Medicine is strange. So you get endocrinologists that call to ask, do you have a Medicare provider number? Hence, the 1,000 hours of logging does end up being worth it.
Okay. But it's like anything. You put the work in, you're going to get the benefit from it.
Yes. Yes.
Sure. Sorry, I've had a cough the last couple of days. As I said, that'll be in the video, but I'll edit that out of the. Where were we? I've lost track now. See, this is what happens when I go off track like that. And that's why I always say, if people ever sit down and watch your videos, they watch the video all the way through, they'll realize there's always stuff ups. And usually it comes from me. It's never from the guest.
Bloopers. That's the fun part.
But from the on the podcast, I edit that all out and make us really smooth. Okay, there we go. So long term, where do you see yourself in a couple of years with what you're doing nutrition wise? If you could have the perfect setup clinic for you, what would be the balance of patients or the type of patients you'd be seeing each day?
Okay, this is hard, right? Because I struggle with this in finding your perfect patient. Yes. It's that, what's your perfect patient profile? And it doesn't necessarily, for me, it changes on a daily basis because everything ignites my passion. I'm very haphazard in my head, clearly. I was having this conversation the other day. So athletes, I mean, I have nothing against them, not my cup of tea. Exercise prescription. Yes, I'll help you. I know a little bit about it, but it doesn't light my fire. So maybe so I like the range, and it's about how you translate what you've done into your clinic. So for me, taking that diabetes education or your diabetic patient, offloading the plantar pressures, so reducing or minimizing your plantar pressures, right? Yeah. And using nutrition to get you the blood glucose levels you want. So just approaching podiatry in a different way. I'm not giving up podiatry. I'm still a podiatrist. I'm just incorporating all these other components into my service or what I offer.
Yeah, and when I talk about having an ideal patient, because I talk about the ideal patient all the time, and just because in your head you may have what the ideal patient is, but I think there's different levels of it where you can have an ideal patient, but I think you should also think about what is your ideal clinic? How's the balance of the clinic look out? Because she might say, I want this particular patient. I almost guarantee you're never going to get 100% of patients coming through is going to be that ideal person, but you can have an ideal balance, or what an ideal day could look like that you sort of strive towards.
Yeah.
And you hope you get there. Okay. You hope a few days, a month, you actually hit that perfect day. Puts a big smile on your face.
Well, even education, right? So at the moment, you know how Queensland Health is running these, I can't even remember what it's called. They took a few health professionals from every field. So if you're a pharmacist, and they basically trained you, and you're out there teaching the community common sense things like exercise, nutrition, how to balance your life, and how to get better, a better balance in terms of your blood test. So it's minimizing chronic disease, really. Right?
Yeah.
And it's things that basically you would think everyone would know, but it's not that straightforward, right? I think we think everyone would know because we come from a health background.
Yeah.
And it's not that easy if you don't come from a health background, because you don't think of these things.
It's like a burr and a 7-year-old.
Like a burr and a 7-year-old.
I'm right back to the beginning. That's what it's like, though. The information we have in our head that we can share with our patients, it's knowing which patients to share what information. And sometimes that's why I would say to you, if I had someone come and work with me, okay, if you ever get a GP come in as a patient, I said, treat them as the dumbest patient you've ever had in your life. Because when it comes to foot problems, most of them have got absolutely no idea. And if you try talking to them at a higher level, it's no different to talking to someone who's a mechanic. They don't understand. So you really got to just remember that doesn't matter who's sitting in front of you. You gotta, to them, it's a 7-year-old seeing a burr. It's all new.
It is. Yes. I had a patient yesterday, actually, that came in. Unfortunately, he hadn't been helped before. So he'd seen other health professionals and hadn't come right. And I have no idea how he heard about me. So he ended up, actually I do. It was a family member. So he sat in my chair and he tells me, this is what he wants to achieve. And like some of it had nothing to do with podiatry, absolutely nothing to do with podiatry, but it was tied in with these podiatry goals because we change lives, right?
Yeah.
You change mobility, by changing mobility, you basically get them more active. So you do change their lives in a different way than other health professionals, which I think is special.
Yeah. Well, my good buddy, Peter Wishney, that's what he says. We give people their lives back. He said, he said, we don't just treat feet, we actually give people their life back. What we do can add 5, 10, 15 years easily to somebody's life.
Exactly. And pain-free, which other profession can do that?
We should be pretty cool.
We are. I think so.
So before we wrap up, if somebody bumped into you and what's a tip that you would give any podiatrist that's listening to you talk now? If you could pass on one bit of advice from your career so far, what would it be?
That's a hard one. That is really a hard one because there's so many things that come to your head. Consistency. Like, I think it's that self-belief or that knowing that direction you want to take, or really taking a step back and thinking about what fulfills you or what makes you happy.
Yeah.
Because earning a paycheck at the end of the day is not going to make you happy when you go to bed at night. It's what fulfills you, or looking deep within yourself. Even that perfect patient profile, knowing the patients that come through your door that give you that sense of fulfillment. I think that's important. When you're young, you're so inexperienced that you do any and every patient, isn't it?
Yeah.
And then as you get older, you think, oh my God, I'm too old for this shit or to take this. And then you basically streamline your practice and rethink what's important.
Well, some people don't do that, and that's why they end up bitter and twisted.
That's true.
They do. Well, they take on any patient from the start, and then 20 years later, they're still taking on any patient. And they haven't refined their business to become more of what they like the business to look. They never think about, how do I want my business to look like in 5 years, and work towards that and keep improving upon it. And then let the new person setting up see all the other patients?
I don't think I realized this pre-COVID. I think COVID has changed all of us. I mean, some people say for the worst. I mean, it's given us a lot of mental health issues, yes, but it's also made you rethink a lot of things. So pre-COVID, I worked very much in my own little bubble. So going into COVID, I realized how different or how important changing or being willing to adapt and change and be willing to pick up your hand and say, help, I need help, or reaching out to your peers. Because it's not only podiatrists that can help you, it's everybody in allied health, or even GPs, it's anybody and everybody. And there are people out there willing to help if you just got to be willing to ask for it.
Yeah, and I don't know why we don't do that. I was talking to, I told you earlier, I was talking to Ivan Bristow about dermatology. So that'll be an episode that'll come out before this one. So it should have already been out. And towards the end, he's going to come back on, and we're going to do a second episode on the business of setting up a dermatology type clinic. Yeah. And it got me thinking, and I said to him, isn't it funny? We go through primary school and we have a teacher that teaches us what to do. And then we go from primary school, we go to high school. We have a teacher that teaches us what to do. And then we go to university and we have lecturers and people with more experience that are teaching us what to do. But all the way through that too, if we're playing sport, we will have a coach in whatever sport we're doing. There'll be a coach that has more experience that will teach us what to do. Then we graduate and we get a job somewhere, and we hope to work somewhere who is going to be a good mentor that's going to help teach us some of the skills of what to do. And then we go and open up our own business, and we think we don't need any freaking help.
It's stupidity, isn't it?
Yeah. And so I'm going to actually shoot a video just on that, just talking about why can you go through all that, and you know that you get a helping hand. And the thing is, I did the same thing. I set up my own business. It was 10 years before I realized, I don't know it all. And it'll be faster if somebody helps me.
Well, today I typed, you need to pull your head out of the sand and look around. Really, you really do, because there's others out there that are doing it so much better and are willing to basically help you. You just have to ask.
Yeah, and you got to ask, and you look around, and I always say, and you got to find. There's so many educational things you can do out there.
You got to do the time.
Yeah.
To get wise.
But it's also finding what. But we were talking before I press record, and I said there's so many opportunities out there too, or educational things that you can do. But you got to look at, does it fit with the direction of your clinic? Is the person who's running it, are they the person you want to do the course with? And it's all these decisions. So Aadila, I want to thank you for coming on here, being very open, sharing. You've got a really interesting story. I've known you for a while now, and it's really funny. It's like when Sally was on the podcast, and you said when you listened to Sally's podcast, you didn't realize how much you did not know about Sally, even though we're in the Spartans group together. Yeah. And we talk all the time.
Well, it's true.
That I will guarantee that everyone in the Spartans group, or anybody else that's been in the 12-week reboot who went through that with you, who know you, would have learned something from this particular podcast.
I'm an open book, so let's wait and see.
We'll wait and see what happens. So thank you very much for coming on, and like I said, openly sharing your story and the whole diabetes and nutrition and everything about your career so far. I think you've got a lot more to give.
I hope so. I'm crossing my fingers. Okay, so after post-COVID, 2022 is my year. I was telling Nikki, 2021 was the year I put my big girl panties on. 2022 is the year I say.
Like you said, one year I said, it was before COVID, and might have been 2016, 2017 or something like that. And I went, 2016 is a year of learning. 2017 was my year of earning. And it's like a friend of mine said, you've got to slow down to speed up. So it's like when you're changing gears in a car. You can't just go and just move through the gears. It's sort of like clutching. The car slightly slows down a fraction before you speed up. And I think in your career all the way through, you've got those periods of learning before you take the next step, learning next step.
Appreciate the journey.
So thank you very much. And I will talk to you again very soon.
Thank you, Tyson.